structure within our skeleton and give our organs protection. Our bones are made of two substances, collagen and calcium phosphate. The collagen provides flexibility, whilst the calcium phosphate provides rigidity.
Both are essential, as if we had no collagen, our bones would shatter.
Yet with no calcium phosphate, they would not be dissimilar to putty.
As well as support, our skeleton protects our vital organs. The skull protects the brain, the ribs protect the heart and lungs. Here is the bone marrow, found within the centre of bones. This produces red and white blood cells along with platelets. Around the outside of the bone is the spongy substance, which keeps the bone light and allows tension and compression. At either end is the dense, compact bone, which gives support and rigidity. Finally, cartilage. Cartilage lubricates friction against other bones. Here is part of a leg bone from a turkey. It hasn't fully decomposed, so the bone marrow is still visible. This is the substance which produces red and white blood cells. Tendons connect muscle to bone. Ligaments connect bones to other bones.
There are 5 main types of joints. Hinge joints, which are found in your elbow and knee. Ball and socket joints, which are found in your shoulder and your hips. Fixed joints, which is where 2 bones meet but cannot move, such as in your head. Sliding joints, such as in your spine. And saddle joints, which are only found in your thumb.
Here is an extracted bone from a baby fox. The ligaments are still attached and not quite decomposed. These hold together bone to bone. Here is an example of a sliding joint from, again, a fox's spine. It moves very slightly, but not too much. Snakes have so many backbones in their spine, they are able to have a nice flexible shape, allowing them to move in many different directions. On the other hand, humans only have a few, and they're much larger. More information on joints can be found on the BBC website. Rickets is caused by a lack of vitamin D and calcium in a child's diet. Vitamin D can be found in oily fish and eggs, along with sunlight. Calcium is found in dairy products. Any child who does not get enough of these is at risk. Rickets is a fairly common disease. It affects bone development and growth. It causes them to become weak, and eventually can cause the bones to bow.
Some forms of rickets can be passed down by genes. Sometimes children with kidney, liver and intestinal conditions have issues absorbing vitamins, so therefore could be at risk of getting rickets. Osteoporosis is a bone disease that causes people's bones to become too weak, increasing chances of fractures and breaks.
Bones repair and grow quickly when you are young, but they continue to grow in density until you're about 35, whereas your bones slow down growing when you are about 16 to 18. After 35, your bones begin to get weaker.
The disease osteoporosis is when your bones weaken at a much faster rate than normal. This disease can also be caused by a lack of calcium needed for healthy bone growth.
Almost immediately after the break, the body begins trying to repair itself. The overall process is divided into 4 parts. When the bone breaks, the fissure severs the blood vessels running down the length of the bone. Blood leaks out of the veins and quickly forms a clot, called a fracture hematoma.
This helps to stabilise the bone and keep both pieces lined up for mending. The clot also cuts off the flow of blood to the jagged bone edges. Without fresh blood, these bone cells die quickly. Swelling and inflammation follow due to the work of the cells removing dead and damaged tissue. Tiny blood vessels grow into the fracture hematoma.
and fuel the healing process.
After several days, the fracture hematoma develops a tougher tissue, transforming it into soft callus. Fibroblasts start producing fibres of collagen, which is the substance needed for flexibility in bones.
Chondroblasts then begin to produce a type of cartilage called fibrocartilage. This transforms the callus into a tougher fibrocartilaginous callus, which bridges the gap between two pieces of bone.
It generally lasts for 3 weeks.
Osteoblasts then move in and start producing bone cells, which then transform into bone callus. This lasts generally for 3 to 4 months and provides the necessary protection and stability for the final stages of the healing process.
At this point, the body establishes the position of the bone within the flesh, begins reabsorbing bits of dead bone, and creates a hard callus to bridge the gap between the two pieces of bone.
However, this bulge of tissue needs a lot of work before the bone can take any strain. Osteoclasts and osteoblasts spend months remodelling the bone and replacing the hard bone callus with dense bone. These cells decrease the callus bulge, gradually returning it to its original state.
The bone's blood circulation improves, and the influx of bone strengthening nutrients, calcium phosphate, strengthen the bone.